During the performing season of marching band, the band is continuously exposed to a variety of stresses if not adequately prepared. Marching can be considered a high-intensity sport that requires the ability to simultaneously perform at high levels of excellence. The visual portion involves exercise of cardiovascular capacity, strength, and flexibility. A field show uses repetition of several muscles. So to begin with the use of muscles in marching band, there is the rectus abdominis. This muscle is also known as your core. It plays a huge role in keeping posture and marching at slides. These are a pair of long flat muscles that extend vertically along the abdomen. The rectus abdominis is located in the front of the body, beginning at the pubic bone and ending at the sternum. The origin is the pubic crest and pubic symphysis, while the insertion is the 5th, 6th, and 7th costal cartilage. When stretching this muscle, we do trunk twists and what we call Hollywoods. We use this muscle in marching band because it also flexes the torso and the spine in the abdominal region. This example shown is marching at a slide, which means to march while facing the sidelines. The latimus dorsi is one of the largest muscles on the back. It works together with the trapezius and the deltoid to hold our posture upright. The latimus dorsi is a triangular flat muscle that covers the lumbar and thoracic areas. The origin is the sacrum and the iliac crest. The insertion is in the intertubercular groove of the humerus. The deltoid, known as your shoulder muscle, also plays an important role. The origin is in the clavicle and the insertion is in the deltoid tuberosity of the humerus. The trapezius is a large superficial muscle that extends from the occipital bone to the lower thoracic vertebrae. The insertion is the scapula. Meanwhile, the origin is the spinous process. When stretching the trapezius, we can simply do neck rolls. For the latissimus dorsi, you can just lift your arms above your head and bend over left to right to get that stretch. We use these muscles in marching band to help with posture, to keep us in the correct upright position, but these muscles also help with marching at slides. Next, there is the bicep brachii and the triceps brachii. They are located on the upper arm between the shoulder and the elbow. The bicep and tricep are fusiform muscles. The origin of the bicep is the scapula and the insertion is the proximal radius. The bicep works to flex the elbow and to supinate the forearms. The origin of the tricep is the shoulder girdle and the proximal humerus. The insertion is the olecranon process of the ulna. Its primary action is to extend the elbow. To stretch the tricep and bicep, we do a variety of stretches. To start off with, we lift the left and right arm over the chest to get the pull. Another stretch is the partner arm stretch that mainly focuses on the bicep. One last stretch focuses on the tricep, and it's called the overhead. We use the bicep brachii and tricep brachii a lot in marching band. The iliopsoas is also known as the hip flexor. Now this muscle plays a huge role in marching band. The iliopsoas is basically made up of three muscles: the psoas major and the iliacus muscle. The iliacus originates in the iliac fossa of the pelvis. The psoas major unites with the iliacus at the level of the inguinal ligament and crosses the hip joint to insert on the lesser trochanter of the femur. To stretch this muscle, we do lunges to get the right stretch. This muscle works for hip flexion and extension, which helps with forwards and backwards marching. The gastrocnemius and soleus work together. They are also known as your calf muscles. The end tendons of these muscles connect to the calcaneus bone in the ankle. Since muscles only contract and get smaller and move from the bottom up, the gastrocnemius muscles allow your foot to move backwards, while the soleus will move in the opposite direction and allow it to pull upward. To stretch this muscle, we do a partner calf stretch, and if there is no partner present, you can simply go up to a curb and do the exact same. So, the gastrocnemius and soleus control the forward and backwards marching. And last but not least, there is the tibialis anterior. This muscle is located in the shin. The tibialis anterior is the largest muscle located in the anterior compartment of the human leg. It dorsiflexes the ankle and the foot. This muscle inserts into the base of the first metatarsal and the medial cuneiform tarsal. The origin is the upper half and lateral condyle of the tibia. To stretch this muscle, we can do lunges. If this muscle isn't used correctly, it causes a bounce when marching, which makes us look sloppy, which is what you've just seen. When the tibialis anterior is used correctly, we are able to lift our toes and roll through our feet, which helps us to march smoothly.